Welcome back to my channel. If you are new here, my name is Jessica, and I have made a channel that chronicles my recovery from pelvic organ prolapse repair surgery that included a hysterectomy, as well as a complete pelvic reconstruction and a perineal repair. So I have lots of videos detailing the specifics of my surgery, if you would like to go back and check those out. But today I'm here because if you are not new to my channel and you've watched any of my videos, you know that I have been very transparent about my entire journey, the specifics of my recovery, the things that I faced. But when I was recently looking back on some of my videos, I realized that there's actually a way I haven't been that transparent with you. My videos, although I look a hot mess and, I am very honest about what's going on with me physically, I realized recently that they all paint a picture of a woman who's pretty strong emotionally. I realized that I never cried in any of those videos, and although I'm struggling, I seem to be pretty strong and, not emotionally struggling with what was going on with me. And I just got to thinking that it's time for me to be real with you about the emotional aspect of everything I went through. I get a lot of emails from women and comments as well, reaching out to share their story or ask questions where they just use words like depressed and hopeless and scared and have anxiety and, just feel so ashamed of what's going on with them and so scared and just having a whole litany of emotions that I think feel guilty for. And so I just want to be really transparent today and tell a little bit of the emotional side of my story, and just basically try to normalize whatever you're feeling related to your prolapses, your surgery, the symptoms that you're having after your surgery, your recovery, all of it. It is totally normal to be falling apart emotionally. And even almost 2.5 years later, I would say that I am still recovering from the emotional aspects of what I faced related to my surgery. So if you've watched, I think, my initial video, I talk about how I discovered my intensive prolapses. They were all level 3 prolapses out of a scale of 4 when my baby was 3 months old. He was my third baby, and we did expect him to be the last addition to our family, but I don't know, being postpartum, I hadn't really reached the point where I had come to grips with, this is my last baby. I was struggling with that idea already, oh, it's my last newborn, it's my last this, my last that. And our plan had always been for my husband to get a vasectomy. So when my surgeon started throwing around the suggestion of me having a hysterectomy, that really hit like a ton of bricks. It was just not something that I was prepared to think about or to talk about, or I had ever thought I'd have to go through. So that in itself was emotional. But if you know me at all, I just kind of swallowed it and I just went on with life. And as my surgery date approached, my anxiety about it grew. And on the morning of my surgery, I legit cried for 2 hours prior to my surgery, to the point where my surgeon was coming in and he was like, "We don't have to do this. Are you sure you want to do this? I mean, yes, doing the hysterectomy is the best way to fix this, but I can do some other repairs that would be, last you a while until someday when you're ready. And, we don't have to do this." The CRNA was very worried about me. Everybody was kind of in my room, like, you don't have to do the hysterectomy if you don't want to. And all the while I'm laying in the bed and I'm thinking, I don't want more kids. I'm pretty 99.9% sure the baby factory is closed for me. But whatever it was, I don't know. I think there was some silly part of me that felt bad about having my perfectly good organs taken out of me. I mean, they were perfectly good in the sense that they were all fine and working fine until they dropped and were almost falling out of my vagina. But they were fine. I had always had normal periods. They weren't painful. They weren't very heavy. There was no reason to consider a hysterectomy for me until all my organs were falling out. or if it was simply the aspect of like, this is for sure, baby factory is closed, no more babies for me. And maybe it was a combo. But this went on until I essentially, we delayed my surgery by a couple of hours for my crying and my pondering. And finally they took me to the OR, and I was still crying on the OR table. And the anesthesiologist was like, "Are you sure?" And I finally said, "Just put me to sleep. Yes, I'm sure. Put me to sleep." And honestly, when I woke up, it was a done deal. And that sadness was over. That part I really haven't revisited somehow miraculously, but I just wanted to share that as a little, just even the thought of having a hysterectomy was very emotional for me. And then, all right, let's talk about recovery. Holy cow. So you may not have seen me crying in my videos, but that is not the reality of my recovery, okay? I cried a lot. I would say a very low moment for me was the day, I was probably, I'd have to look on my videos, day 3, day 4 post-surgery. And I discovered, I didn't know what it was, but come to find out it was just a very large hemorrhoid down there that was the result of all of my stitching. And it was so painful and so swollen, and just, I had contacted my doctor's office to find out what it was, and they asked me to send them a picture. Okay. I pretty much had no modesty at this point anyway. I mean, when you've had 3 vaginal deliveries, I had had a previous surgery to my rectum area to fix some misstitching from my first delivery 13 years prior. I had already had all of these prolapses for a while, had those discovered, but when someone asks you to send them a picture via email of your anus, it was a very humbling low moment of like, all right, this is really my life. This is my story. So that was a very low moment. I cried for quite some time that day. I cried a lot about the strain it was putting on my husband and my family. Again, I had this surgery when my newborn was 4 months old. And again, I explained in another video that my baby had a lot of issues of his own. He had been born with laryngomalacia, which, to make it very brief, means that he had a lot of breathing issues, feeding issues, suck, breathe, swallow issues. He was seeing a pediatrician, a gastroenterologist, a pulmonologist, a ENT, and the feeding clinic at our local hospital. And so we had a lot going on with him. We also had a 2.5-year-old, we had a teenager. It was a lot. And I was basically resigned to have to sit on the couch and watch my life pass me by. And, that was sad that I couldn't really help with care of my baby. I mean, if it was something where he was just willing to lay on me and I could feed him, perhaps, but I couldn't pick him up. I couldn't help with his baths. I couldn't, move about my house. I couldn't help my 2.5-year-old when he was throwing a fit and needed something. I couldn't help my husband cook or clean or do laundry or anything that needed done around our house. And I felt so helpless and so depressed. And it was also really hectic. Sometimes the 2.5-year-old would be throwing a fit about something. My teenager felt totally caught in the middle. She was super anxious about what I had been through, didn't know how to help. The baby would be crying. My husband's in the middle of trying to make dinner by himself. We didn't have family in the area. And I just felt so many emotions, like guilt, sadness, anger, frustration. Like, why the hell is this happening to me? Why am I having to go through this? I'm too young to go through this. It's not fair. I know so many other people who've had bigger or more babies, or, do CrossFitting and all these things that should make their organs prolapse. And why me? Why do I deserve this? What did I do wrong? Oh my gosh, I had a lot of thoughts, as you can tell. I would say, once I got back to work and life got a little bit more normal, a lot of those feelings went away. And again, my typical personality, I just moved on. Like, okay, back to real life, moving on. But it kind of reared its ugly head about a year to 2 years later. I would say about 1 year after my surgery, I started realizing I did not feel like myself. I was dealing with some very mild hormonal symptoms at that point. By the 2-year mark, they were getting a little more intense. And if you've seen my video detailing my hormone therapy at 2.5 years post-surgery, I am now on a hormone therapy regimen. And I will never know really if it was from my hysterectomy and going into ovarian failure because all the other organs, primarily the uterus, which is kind of like the hub of all your reproductive organs, was removed, or if it was just classic perimenopause. I don't know. I'm almost 40, so I really don't know. But even after being put on what we think is the correct hormone cocktail, I still just didn't feel like myself. Sad, lack of interest in things, just a lot of negative thought patterns, no energy, not sleeping well, lots of headaches, some like just, I don't know, feeling like I couldn't think clearly. I had a couple of minor car accidents in the course of 3 months. And all I could ever attribute them to was I'm just feel out of it. Like I just have brain fog. Like, it feels like I've taken cold medicine. It couldn't be attributed to I was on my phone. So my family practice doctor convinced me that I should consider an antidepressant, anti-anxiety medication. So I do take that now. I'm probably 3 months into that, and I do think I'm feeling better. I slowly but surely, I'm laughing more, I'm smiling more, I'm enjoying my family more, I'm thinking less about all the negative things. But I mean, I think in reality, ladies, we have to accept that this is a form of trauma. It really is. There's lots of kinds of trauma, and there's obviously worse kinds of trauma than what we're going through. But at any point in your life, but especially if you're on the younger side like me and you find out you have this thing going on, prolapses, which are painful, embarrassing, irritating, make basic functions like urinating and bowel movements difficult, make sex uncomfortable, and kind of drive this weird wedge between you and your husband. I mean, previous to surgery, it's just uncomfortable because your organs are in the way. After surgery, it's just a whole new ball game for a while. You got to refigure things out, refigure what feels good, what's okay, what type of penetration are you comfortable with. Like, it's just, it takes a toll. And then there's all the things that happen in the post-recovery journey. There's a lot going on there. And I think as women, we have so much to do and so many people to take care of that we just try to swallow it all and move on. And we never give ourselves the grace to say, this is a lot. What I'm going through is a lot. And I need to just actually allow myself to process it. I need to cry if I want. I maybe need medicine. I maybe need therapy, whatever the case is. Because, I think our husbands try, but they can't understand what we've been through emotionally, physically, any of it. And even your best friends, your mom, your sister, whoever, until they've been through what you've been through, and hopefully they never have to, nobody gets it. So I just think we need to give ourselves the grace for the reality of what this is. And it's hard. It's hard in every capacity. That surgery is the most physically painful thing I've ever been through. It was also the most embarrassing and humbling and just physically challenging thing I've ever been through. So it's tough. It's something that I truly think we have to get over and heal from. We're not just physically healing, but we are emotionally healing. So it was just really important to me to let you know that however strong you may have thought I appear in my videos, I've even had some women say, I don't know how you did it. You're so strong. You held it together so well. I just want you to know that was not the reality every moment of my recovery. I think, I obviously chose times where I felt I was in the right headspace to make a video, and I didn't think it would be a good video if I was sobbing the whole time. So I probably chose times where I was feeling better to make those videos, but it wasn't the reality. I cried a lot, and it was difficult on my marriage, and it was difficult on my kids, and there have been long-term effects that I've needed to process as well. So if you're feeling any of the ways that I am now, if you're maybe out in the recovery phase from your surgery and you are just not feeling like yourself, I encourage you to get help. Talk to your doctor, especially if they're a female doctor. I think they'll be very understanding of this and say like, yeah, this has been a lot. So let's consider some options for making you feel better. But just mostly know you're not alone, and whatever you're feeling, sadness, anger, depression, anxiety, fear, frustration, disappointment, hopelessness, whatever it is, I promise you it's totally normal, because this is not a situation that everyone faces, and it's a lot. So, as I always say in my more recent videos, I have been blown away by the interest in this channel, the women I'm hearing from, the number of views and comments, and the only ask I would have of you is to please just hit that subscribe button, and that will make my videos show up in more searches for more women to find this content who need it. That was the whole goal of this channel from the first video I made when I was still laying in my hospital bed, is just to tell more women about this, to be a resource and a support for them, and to answer questions that I wondered about when I was heading into surgery. So hit that subscribe button, tell any ladies you know who are dealing with any of this to check out my channel, and good luck.